3 years ago, at the age of 48, Louise was forced to take on a lot of extra responsibility at work. She felt exhausted all the time, hardly slept, and her appetite diminished. She also had some mild but persistent abdominal pain, so she decided to go and see her GP for an assessment. Rather than take a thorough history and examine her, the doctor put her symptoms down to stress and advised her to consider weight loss surgery. When she refused to consider this, he put her on sick leave for a week and advised her to catch up on some sleep. A week later, Louise went back because she wasn't feeling better and didn't think she could go back to work. She was still feeling tired, her abdominal pain persisted, and her appetite hadn't returned. Her GP still didn't examine her or ask any questions, but instead advised her to go back to work and try to reduce her hours. He said that work could be a little draining, especially for people with larger bodies, and she needed to learn to push through and get tougher. Louise had been working full-time since the age of 23 and had never struggled in the past, but her GP made it clear that he wasn't interested in discussing it any further, so she returned back to work the following day. A month later, Louise didn't show up to work one morning and was not answering her phone. Her colleagues were concerned because it was very unusual behaviour, so one of them went to check in on her. They found her collapsed on the floor and called emergency services. Louise was rushed to the hospital and it became clear that she had a large stomach ulcer that had perforated. She required surgery and was in a coma for 6 weeks. During that time, her kidneys failed, her lungs failed, and she finally had a cardiac arrest. It was touch and go for some time, and when she finally woke, she was completely paralysed. She required 6 months as an inpatient in a rehabilitation centre, and now, 3 years later, she still has not regained her full mobility. She is only able to walk with crutches for very short distances and uses a wheelchair the rest of the time. She is also no longer able to work. As far as Louise is concerned, all this happened because a doctor saw a fat person trying to get time off work, as opposed to a person with a life-threatening medical condition. In spite of everything she has been through, the doctor has never once made any attempt to contact her or make amends.